Dear students, a warm welcome to the class on medical termination of pregnancy, sexually transmitted diseases, and infertility. First, we'll study about medical termination of pregnancy. Medical termination of pregnancy. The term itself means terminating pregnancy. In the first unit, human reproduction, we have studied about pregnancy, parturition, and lactation in detail. And here we have understood that the pregnancy is the most beautiful phase in the life of a woman. Then why terminating this pregnancy? We will be studying about this in more detail. Medical termination of pregnancy or induced abortion by definition means intentional or voluntary termination of pregnancy before full term. Your full term is the gestation period. The gestation period in human beings is 9 months. So terminating pregnancy before 9 months is MTP. So here there are few pictures how the abortion takes place. Now here we can see the fetus is almost in the end of the first trimester and beginning of the mid of the second trimester. Here the leg is pulled out, and then here you can see a sharp object is forced near the neck region. In this way the brain is punctured and the skull collapses and it is pulled out through the vagina. So it is not an easy procedure. Here the fetus is literally chopped or broken into pieces and removed out of the body of the mother. Now why this? Why do you think MTP is conducted? Almost I think everyone will have an answer for this. That is to get rid of unwanted pregnancies. Now these unwanted pregnancies may be due to rape, or it may be due to unprotected sexual intercourse, or it may be due to failure of contraceptives used during coitus. So this is basically to get rid of unwanted pregnancies. But is it right? Is it right to get rid of unwanted pregnancies in these two conditions? MTP is essential in few cases. That is, it is the significance of MTP. MTP is essential if the continuation of pregnancy could be harmful or even fatal to the mother. Sometimes mother may have conditions like heart diseases or high blood pressure or any other diseases which can be harmful to the mother's body or even fatal to the mother's body. In such cases, the MTP can be conducted. Secondly, if there is possibility of child born with severe physical and mental disability, even in such condition, medical termination of pregnancy is allowed. So the importance of MTP is either to protect the mother or only in such cases where the child born will face severe physical and mental disability. So in these cases, MTP is allowed. The MTP also has its role in decreasing the population or in lowering the growth of the population, but it is not meant to do so. MTP is not basically used to decrease the population growth. Moving on, when can MTP be conducted? Now, MTP can be conducted during the first trimester. Now, you all know the first trimester is the first 3 months of pregnancy. So, in this 3 months of pregnancy, you've already studied how the embryo develops. So, MTP is considered to be safe during the first trimester, that is, first 3 months. That is, you've seen in the first month heart is developed, and second and the third month the other organs are developed. Here you can see during the third month almost the structure of the baby and most of the organs are formed. Now MTP during the second trimester is riskier. Second trimester is from 3 to 6 months. Here you can see the 6 months the baby is fully grown, all the parts are grown. So at this point of time the MTP is considered to be riskier for the mother. And above second trimester it poses very high risk to the body of the mother. It is conducted most of the time in case of stillbirths or in case of certain problems where the mother's life is at risk. Otherwise, after second trimester, the MTP is not conducted. Next, moving on to the abortion worldwide. Nearly 45 to 50 million MTPs are performed in a year all over the world. Can you imagine? It accounts to 1/5 of the total number of conceived pregnancies in a year. So 45 to 50 million MTPs are conducted all over the world in a year. And in India itself, it is approximately 6 to 7 million per year. Moving on to the drawbacks of MTP. First drawback of MTP is most of the time performed illegally by unqualified doctors, which could be fatal to the mother. Secondly, it is misused for female feticide, that is to destroy the female fetus. So these are the two important drawbacks of MTP. And the female feticide is mainly conducted as amniocentesis. We have already studied this process. What is amniocentesis? So we have studied about the amniotic fluid which is present in the amniotic sac, which is present around the embryo, developing embryo. So during the process of amniocentesis, amniotic fluid is withdrawn to study the fetal cells, and as the fetal cells are studied, it is also used to determine the sex of the fetus. So it is misused to determine the sex of the fetus. And if the fetal turns to be a female, then most of the times in India, in many places, the female fetus is destroyed or the female feticide is conducted. Uh, Female fetus is destroyed by medically terminating pregnancy. So these are the two important drawbacks of MTP. Moving on to the next slide. Legalization of MTP is being debated in many countries. So in many countries, MTP is legalized and in some it is not. It mainly depends on emotional, ethical, religious, and social issues involved in it. Now, there are a lot of religious issues involved in it. Ethically, also, it is wrong for a doctor to conduct illegal MTPs. And emotional, there is a lot of emotional and psychological factor also involved in a person who is undergoing MTP. Government of India has legalized MTP in 1971 with some strict conditions to avoid its misuse. That is, no to female feticide. In India, female feticide is illegal, so no to female feticide, as well as it should be conducted by a qualified doctor. Most of the times in most of the hospital, MTP is not conducted unnecessarily. That is in case of failure of contraceptives or in case of unprotected sexual intercourse. Such pregnancies are not terminated by MTP. To conduct MTP, there should be valid reasons, like either the child has severe chromosomal abnormalities or the pregnancy is fatal to the mother. In such cases only the MTP is conducted by a qualified doctor in India. So even here there are few conditions, that is the MTP during the first trimester to be conducted by the advice of a doctor, one doctor, and for during the second trimester, two doctors have to involve in this and they need to take opinion of even a second doctor. So these are some of the strict rules laid by the government of India after legalizing MTP. Now, Is MTP the only solution? Or how can we prevent this MTP? So MTP is not the solution. So how can we prevent this is by effective counseling on the need to avoid unprotected coitus, that is use of contraceptives, especially condoms and pills are easily available. So people should be effectively counseled to use contraceptives and to prevent unwanted pregnancies. Second risk factor, second point here is the risk factor. The people should be educated about the risk factor involved in illegal abortions. Thirdly, providing more healthcare facilities for pre and postnatal care. And fourth point here is to educate people on gender equality. So if the people are educated on gender equality, if there is a equality between a male and a female, female fetus will not be destroyed, there won't be female feticide. Also, the risk factor involved here in illegal abortions, that is, if the abortions are conducted by unqualified doctors, then it can pose a risk on the health of the mother, or it can even be fatal to the mother. So these are some of the points to be remembered to prevent pregnancy. I hope MTP is clear. Next, moving on to sexually transmitted diseases. Now, the term itself says sexually transmitted diseases. The diseases transmitted through sexual intercourse. So what are sexually transmitted diseases? They have different names. Sexually transmitted diseases can also be called as venereal diseases, also be called as respiratory tract infections. And these diseases are mainly transmitted through sexual intercourse. So this is the definition of sexually transmitted diseases. So there are a few examples for sexually transmitted diseases. Now this is an important 2-mark question. Some of the examples are gonorrhea, syphilis, genital herpes, chlamydiasis, genital warts, trichomoniasis, hepatitis B, HIV, leading to AIDS. So these are some of the examples of sexually transmitted diseases. Out of these here, gonorrhea, syphilis, chlamydiasis are all bacterial infection. Trichomoniasis is a parasite protozoan infection, and genital herpes, genital warts are all viral infection. Hepatitis B and HIV, these are viral infections. So now HIV infection is the most dangerous of all, as it has absolutely no cure. Now, what are the infections like hepatitis B and HIV? Now, we have already studied these are sexually transmitted diseases, and these diseases can only be transmitted through sexual intercourse. But mainly hepatitis B and HIV can also be transmitted. Even the other diseases can also be transmitted through these mode, but mainly hepatitis B and HIV, these are more severe infections, and this can also be transmitted by sharing of injections or needles with the infected person. This can mainly happen between drug addicts. So sharing of needles, especially with the infected person, that is a person with HIV or hepatitis B or most of the sexually transmitted diseases, they can transmit the infection. Secondly, even if the surgical instruments are not sterilized, even then the disease can be transmitted. Next is transfusion of blood. So if the blood is transfused from an infected individual, then there are chances of the recipient getting the infection. So this most of the time is not possible these days, because the blood banks screen for 5 important diseases, in which HIV and hepatitis B are two of the important diseases that are screened from. So most of the time transfusion through blood is rarely happening these days, but if infected blood is transfused, then definitely the recipient will get the disease. And from infected mother to the fetus. So the sexually transmitted diseases can be easily transmitted from infected mother to the fetus. Most of the time during the time of delivery, there is a possibility of the mother's blood getting into the fetal blood. So because of this, there is a chance of transmitting the sexually is transmitting any of these diseases from the mother to the fetus. So these are some of the infections, and this is some of the mode of transmission that takes place. And HIV has no cure. Your textbook says genital herpes, genital warts, and HIV, hepatitis B as no cure. But early detection of herpes and warts and hepatitis B, there is cure, but HIV has just no cure at all. Moving on to the symptoms of STD. The symptoms of STD, the early symptoms include fluid discharge, slight pain in the genital region, and swellings in the genital region. So these are the early symptoms which are not severe. So there's always a delay of reporting these symptoms or getting them treated. So what happens? Most of the times the females are asymptomatic. That is, there are no symptoms seen in female most of the time, and thereby they remain undetected for a long time. And this can result in further complication. So complication that occurs due to late detection is a disease called as pelvic inflammatory disease, abortions. So if a female is pregnant and she has sexually transmitted disease in her, she can undergo abortions. There can be stillbirths. There can be ectopic pregnancies. Ectopic pregnancies takes place outside the uterus, that is most of the times in the fallopian tube. And infertility. Even infertility is a topic which we'll deal next after sexually transmitted diseases is infertility, and even cancer of the reproductive tract. So these are all the symptoms of STD. Let's quickly have a recap. The early symptoms include fluid discharge from the genital region, the slight pain in the genital region, and swellings in the genital region. Most of the times females are asymptomatic, that is they have the disease in them but there are no symptoms and they remain undetected for a long time, which can lead to further complications like pelvic inflammatory diseases, abortions, stillbirths, ectopic pregnancies. As I told you, these pregnancies take place in the fallopian tube and the embryo can't grow in the fallopian tube, so thereby there can be abortions or it can prove fatal even to the life of the mother. Infertility and even cancer of the reproductive tract. So we don't have to fear about sexually transmitted diseases. There is prevention for the sexually transmitted diseases. That is, this is the only way where we can prevent this. One is avoid sex with unknown partners or multiple partners. So by avoiding sex with multiple partners and unknown partners, this STD can be prevented. Next is use of condoms during coitus. Now condom is the only contraceptive which acts as a barrier between the genital organs. That is, it covers the genital organs and prevents the body fluid to come in contact with each other, thereby preventing the sexually transmitted diseases or transmission of sexually transmitted diseases. And the third preventive measure is, in case of doubt that if a person has STD, the person should go to a qualified doctor. This is very important because most of the times it is asymptomatic, and if the doctor is not qualified, maybe it goes undetected. So go to a qualified doctor for early detection and get complete treatment if diagnosed with the disease. So this is very important. So first and foremost is to avoid sex with multiple partners or unknown partner, use of condoms during coitus, and the next important thing is, in case of doubt, go to a qualified doctor, get early detected, and get complete treatment. So this is the only way to prevent sexually transmitted diseases. So we are done with the two topics for now. We are done with MTP. We are done with sexually transmitted diseases. Both the topics are important, as you get 3-mark questions and 2-mark questions from these topics. Next, we move on to a very important topic, which is very important in your examination point of view, that is infertility. Now, what is infertility? Infertility means when a couple is unable to produce children in spite of unprotected sexual cohabitation. It means when a couple is unable to conceive in spite of unprotected sexual intercourse. So when a couple is unable to produce children in spite of unprotected sexual intercourse, it is called as infertility. The risk factors could be many, the reasons could be many. The reason could be physical, the reason could be congenital diseases, it could be drugs, it could be immunological and psychological problem. First important thing is physical. Physical is maybe the reproductive organs are not functioning properly. Maybe there is the motility of the sperm is low. Maybe the count of the sperm is low. Maybe the ovum production doesn't take place on time, or there is irregular periods. There is the congenital diseases. Maybe the chromosomes here, which are responsible for the production of gametes, are have certain problems in it. Drugs and alcohol can also lower the production of gametes in the body. And immunological and psychological problems. Psychology, the emotional and psychological status of the body is also very, very important for the production of gametes. So these are some of the reasons. Here you can see irregular periods. So this is one of the important factor wherein we have to be alert. If there is irregular periods, go and get checked. History of STDs, even in case of sexually transmitted diseases, there is it's also a reason for the couple not to conceive. Obesity, age, again smoking and drinking, that comes under drugs, past cancers, all these are some of the reasons for infertility. Now, what are the infertility clinics? They are the specialized healthcare units that help in diagnosis and treatment of any disorders related to infertility, and thereby enable the infertile couples to have children. So you would have seen a lot of infertility clinics around in the city. They can be also associated with hospitals. So they are specialized healthcare units wherein the doctors are only specialized to treat the infertile couples and help them in having children. So they basically help in diagnosis and treatment of the disorders related to infertility. Now, suppose the corrections are not possible in infertility clinics, the treatment is not possible in infertility clinics, then these couples can go ahead with some technologies called as assisted reproductive technologies. Now, assisted reproductive technologies are special techniques. They are special techniques that assist the couple to have children. Now, this is very, very important for 5 marks. So, what are infertility clinics? They are specialized healthcare units that enable the infertile couples to have children by diagnosing and treating any disorders if they have. So suppose if the diagnosis and treatment is not, the diagnosis is possible but the treatment is not possible, then they can be still conceive, the couple can still conceive by assisted reproductive technology. So assisted reproductive technologies are special techniques that assist couple to have children. So what are the different assisted reproductive technologies? Firstly, in vitro fertilization. Second, embryo transfer. Third, zygote intrafallopian transfer. Gamete intrafallopian transfer. Intracytoplasmic sperm injection. And artificial insemination. So all these assisted reproductive technologies are very important for your exam. So moving on to the first assisted reproductive technology, that is in vitro fertilization. In vitro fertilization and embryo transfer together is called as test tube baby program. You would have heard about this term, test tube baby. So it mainly includes in vitro fertilization and embryo transfer. Now, what is in vitro fertilization? Now, this term is very important over here. In vitro means fertilization taking place outside the body. In vivo means inside the body. In vitro means outside the body. So in vitro is outside the body. So Firstly, the definition. Fertilization outside the body, that is in the laboratory, in almost similar conditions as that of the body. So in control conditions, that is in conditions as that of the body, the fertilization takes place. And where does the fertilization takes place outside the body? In the laboratory. So what are the important points to know here? First and foremost, ova from the wife or the donor female is collected, and sperms from the husband or the donor male is collected. And in the laboratory, it is induced to form zygote. So here there is a picture where you can see this is the uterus. You can see these are the ovaries. Now this is a stepwise procedure where you don't have to study in detail about in vitro fertilization for your exam. This is just for your additional information. So here first what is done is the ovaries are stimulated. You can see here the ovarian stimulation is done by hormone therapy. The ovaries are stimulated to produce ovum. Okay, so it is a technique where more than one ovum is produced. It is called a superovulation. After which you can see this needle over here. It's a vacuum pump through which the ovums are collected here. Hmm? And in this test tube, you can see the sperms are already there in this test tube. So sperms are collected, the ovum is collected, and if you can see here, this is a petri dish. Okay, in the laboratory, this is a petri dish, and here the conditions are as that of the body. The petri dish will also have a culture medium so that the ovum and the sperms survive over there and they fertilize and give rise to a zygote. So there will be multiple ovums here and there will be sperms fertilizing these ovum, and the ovum here you can see it develops. It forms first it forms zygote. From zygote it will form two cell stage. It undergoes cleavage. You have studied in the last unit. It forms two cell. Sorry, here two cell. It forms 4 cells, then it forms 8 cells, it forms 16 cells. That is nothing but the development of the embryo. So here zygote, it has formed. You see from here, zygote is formed, embryo. Okay, so this is in vitro fertilization till the zygote is formed. So once the zygote is formed, the embryo, that is, once the embryo is developed, the embryo is transferred into the body of the female who wants to conceive. So I hope in vitro fertilization is clear. To repeat once again, in vitro fertilization is a fertilization that takes place outside the body. It takes place in the laboratory in the similar conditions as that of the body. So here the ovaries are induced with the hormones so that the superovulation takes place and ovums are collected. The sperms are also collected from the donor or the husband. Here ovum is collected from the donor or the wife, and then it is allowed to fertilize in the culture medium, and then in the culture medium the embryo develops. So next is the embryo transfer. So let's see how embryo transfer takes place. So this is how a zygote develops. Zygote undergoes cleavage to form 2 cell stage, then 4 cell, then 8 cell, then it forms morula, and then it forms blastocyst, and you know this blastocyst gets implanted into the wall of the uterus. So embryo transfer includes are of two types. One is ZIFT, that is zygote intrafallopian transfer. So first we will see what is ZIFT. So this is zygote intrafallopian transfer. So zygote early embryos up to 8 blastomere stage. You know the zygote forms 2 cell stage, 4 cell stage, and now it has formed 8 cell stage here. Now this embryo at 8 cell stage is introduced into the fallopian tube. You can see this is a catheter over here. And this is the fallopian tube. You can see this is fimbriae, then infundibulum, ampulla, isthmus. So this embryo is introduced at the 8 cell stage. It is introduced into the fallopian tube. So this is called as zygote intrafallopian transfer. The term itself says zygote, intra is inside, fallopian, inside the fallopian tube, it is transferred. So zygote intrafallopian transfer. Next is intrauterine transfer. That is the embryos more than 8 blastomeres, that is 16 and up to 32 cell stage, are transferred into the uterus. Okay, so this is called as intrauterine transfer. Here you can see more than 8 cell stage. This is 16 cell stage. So you can see through the cannula it is directly inserted into the uterus, and then it grows to 32 cell stage and gets implanted here in the wall of the uterus. or even 32 cell stage blastocyst can also be transferred. So this is about the embryo transfer. I hope it is clear. This is in vitro fertilization and this is embryo transfer. In vitro fertilization, the ovum is collected, the sperm is collected, the sperm and the ovum in the lab fuse to form zygote. This is in vitro fertilization, and zygote develops to form embryo. At 8 cell stage, the embryo is transferred in the fallopian tube. So this is called as zygote intrafallopian transfer. More than 8 cell stage, the embryo is transferred into the uterus. So this is called as inside uterine uterus. So inside the uterus. So this is about embryo transfer, very important. It can come for 2 marks, it can come for 5 marks, the entire assisted reproductive technologies. Now embryo formed in vivo fertilization, that is fusion of gametes within the body of the female, could also be used for such transfers to assist those female who cannot conceive. That is, if this zygote grown in the body of a female, developing embryos can also be removed and can be transferred into the females who want to conceive. The next assisted reproductive technology is called as GIFT. This is called as gamete intrafallopian transfer. Now, gamete intrafallopian transfer is the transfer of ovum collected from the donor into the fallopian tube of the recipient female who cannot produce ovum but can provide suitable environment for fertilization and further development. So this is how you can see here. Now your textbooks just gives the transfer of ovum collected from the donor female into the fallopian tube of the recipient female who wants to conceive but who cannot produce a ovum, but a womb is fit for fertilization, that is uterus is fit, fallopian tubes are all fine for fertilization and for the development of the fetus. So actually the procedure is as follows. The ovum is retrieved from the ovaries of the donor. So ovum is collected from the donor female and this ovum is mixed with the sperm in a catheter. Okay, so it is mixed with the sperm here in a catheter, and the egg and the sperm mixture is inserted into the fallopian tube. Okay, so that is why it is called as gamete intrafallopian transfer. That is, both the egg and the sperms, gametes, are transferred into the fallopian tube. So it is called as gamete inside the fallopian tube. So this is called as gamete intrafallopian transfer. I'll repeat this once again. This is transfer. This is how it is given in your textbook. It is transfer of ovum collected from the donor into the fallopian tube of the recipient female. So the ovum is collected from a donor female and it is introduced into the fallopian tube of the female who wants to conceive, but this female cannot produce the ovum but can provide environment for the development of the fetus. So the actual procedure is this way. The eggs are collected from the donor female. They are mixed with the sperm preparation in the catheter. This is the catheter, and both the gametes are transferred in the fallopian tube. So it is gamete intrafallopian transfer. Gametes are transferred into the fallopian tube. So this is about GIFT. Next, moving on to ICSI, or intracytoplasmic sperm injection. All these are also very important for 1 marks as expansions, abbreviations, which are given for expansions. So intracytoplasmic sperm injection. Now this is simple to understand. Now this takes place in the laboratory. The ovum is collected, the sperm is collected, and then sperm is directly injected into the cytoplasm of the ovum. You can see this is the ovum. This is the cytoplasm of the ovum. The sperm is injected using a catheter into the cytoplasm of the ovum. And then in the lab condition itself, embryo will develop and then embryo transfer will take place. You have studied about 2 methods of embryo transfer, that is ZIFT, zygote intrafallopian transfer, and you also studied about intrauterine transfer. So in the same way, embryo is then transferred into the uterus as fallopian tube of the female who desires to conceive. So importance here is mainly in men whose motility of the sperm is less or count is less, in such cases this method is used. So the sperms from such men are collected, and if they desire to conceive, then the ovum of their wife is collected, and then the sperm is injected into the cytoplasm of the ovum. So this is intracytoplasmic sperm injection. Intra, inside cytoplasm of the ovum, sperm is injected. Next, moving on to artificial insemination. Now, this is a very familiar term to everyone. Uh, Here, the semen is collected either from the husband or the healthy donor. So sometimes here you can see the semen is collected. It is collected either from the husband, or it is also collected either from the healthy donor, and it is artificially introduced into the vagina, or it can be introduced here into the vagina, or it can be directly introduced into the uterus of the female. So if it is introduced into the uterus, then it is called as intrauterine insemination. Okay, I'll repeat this once again. The semen is collected. So first the semen has to be processed in the laboratory. There is a method to process it, centrifugation and all this is done. And then these sperms, you can see here, yeah, it is introduced, either it can be introduced into the vagina or it can be introduced into the uterus. If it is introduced into the uterus, it is called as intrauterine insemination. So this is about artificial insemination. So even this method is used in males who cannot inseminate. In case of, yeah, in case of a couple whose husband or cannot inseminate, or has low sperm counts, again the motility is low. In such cases, the sperms from the husband can be collected and it is introduced into the wife, or the female, whoever wants to conceive, in the vagina or in the uterus. So in the uterus, it is intrauterine insemination. I hope this is clear. So this is already mentioned: inability of the male partner to inseminate the female, or very low sperm counts in the ejaculate. So this is about assisted reproductive technology. Now, assisted reproductive technology, we are done with all the assisted reproductive technologies, and I told all are very important in the examination point of view. Now, these are very helpful for the couple who would want to conceive, but it has its own limitation. That is, it requires specialized professionals. So extremely high precision handling by specialized professionals, or else it can go wrong or it may not be successful. As well as it is very, very expensive. The instruments used here are very expensive. This technique is very expensive. Thereby, its benefits are affordable to only a limited number of people. That is, the only people who can afford can take its benefits. So these are the drawbacks of ART. Now, always there is one way, that is adoption. So there are huge number of destitutes and orphan children who can be adopted. So most of these children, if they're not taken care properly, they may not even survive till maturity. Our laws, the laws of the country, also permit legal adoption, and I must say that it is one of the best methods for the parents who are looking for parenthood. So, of all the assisted reproductive technologies, they are good. People can try it, but this is also one of the important method to have children, or for the parents who are looking for parenthood. So with this, we complete the three important topics, that is medical termination of pregnancy, sexually transmitted diseases, and infertility. Thank you.